Hi everyone, this is Sree Divya. Welcome to Singapore Psychological Society YouTube channel. Today we are going to explore about psychosomatic disorders. So how stress, anxiety and other psychological factors really lead to physical illnesses. So in recent times this topic has really gained its importance because many people struggle with physical illnesses, discomfort without even realizing the psychological aspects, psychological connection with their physical illnesses. So, in next few minutes, I'll be walking you all through about what is psychosomatic disorders or how it happens and how to manage them, how to treat them, the coping techniques of psychosomatic disorders, and much more about psychosomatic disorders. So, without wasting any time, let's get started into the video. So, before getting deep into the topic, like how the psychosomatic disorders are caused, how to diagnose them, what are the coping and managing techniques, and treatment methods, limitations, and scope of the psychosomatic disorders, we'll be knowing about what are the psychosomatic disorders. So, psychosomatic disorders are also called as psychophysiological disorders, and there's a condition where the body and mind both are closely connected with each other. So the term psychosomatic was coined or introduced by Henroth in 1880, and in 20th century it was also being called as psychophysiological disorders. So this is a condition which involves physical symptoms that caused by mental disorders, mental factors like stress, anxiety, and depression, etc. And so the key idea of this topic is both mind can affect the body and the body can also affect the mind. So next slide. Here we talk about different categories of people who experience psychosomatic illnesses. So, generally, everybody might have experienced this kind of mental illnesses or mental disturbances at some point of time. But when these disturbances are for a shorter duration of time, it is just called a disturbance or a illness. But when this is prolonged for months, years, or sometimes decades, they gets converted into disorders, and these disorders are called psychosomatic disorders. So here are some major categories of people who experience psychosomatic disorders. So first category of people are those who experience mental illness with medical ones. So these people will be having mental disturbances along with supporting medical documents. Generally autism patients will come under this category. And next category is people who experience a psychiatric issue, which is a direct result of a medical issue. So depression from a cancer treatment or post surgery traumas, that kind of people will be having a will be experiencing psychosomatic disorders. And next is people with mental illness along with the physical symptoms with zero medical explanation. So these kind of people will not be having any medical issues. So their physical symptoms or physical illnesses will not have any supporting medical documents. Despite of that, the person will be experiencing some or other kind of physical illnesses. And Next category of people are people with body dysmorphic disorder. So generally a person who is very obsessed with his physical appearance will come under this category. So even a small wrinkle on his face will create lot of disturbances and lot of anxiety disorder within him. Because of that, the anxiety will impact his the person's ability to function properly even in his normal day to day activities. Next comes hypochondriosis. So, this is a kind of mental condition wherein the person is excessively worried about having developing a serious mental illness. So, even his medical reports are normal and doctor won't find anything serious. The person with just a normal body sensations like headaches or stomach aches, he might interpret those signs as serious medical illnesses. So, these kind of thoughts are very hard to control, and they are not fake. These thoughts are not fake or not attention seeking behavior. So generally the treatment for this hypochondriosis is CBT, cognitive behavior therapy is the most effective treatment for this. Coming to the next slide, here we'll be knowing more about origin, causes, and theories of psychosomatic disorders. So, in major, there are three theories of psychosomatic disorders. One is family dynamic theory, biological theory, and personality theory. We all know that in general, individual exhibit specific physiological responses to certain emotions. So, if a person is emotionally angry, he will naturally get an increased rate of blood pressure. Likewise, if a person experiences a stressful or conflicting interpersonal relationships among his family members in childhood, so he is prone to develop certain kind of psychosomatic disorders in the future. And when it comes to biological theory, first degree of relatives, monozygotic twins are prone to get psychosomatic disorders. Next comes personality theory of psychosomatic disorders. So it says every individual with specific personality traits may increase the risk of specific physical illnesses. So here from the below table, you can see personality characters and related psychosomatic disorders. So if a person is depending personality, having depending personality, he's prone to get asthma. And if a person is very anger in his personality, there is a high chances or high risk of getting peptic ulcers. And the person is aggressive, he may get heart diseases. And self-sacrificing person may get arthritis, and compulsive person may get migraines in coming future. So whenever a person is uh, frequently having these kind of personality behaviors, so he is prone to, or he may increase the risk of these kind of psychological disorders. So these are some common physiological disorders that people generally experience in association with psychological illnesses. So gastrointestinal issues like IBS and peptic ulcers, and cardiovascular disorders like hypertension, palpitation, and respiratory disorders like asthma, and musculoskeletal disorders like chronic pain, tension, headaches, and dermatological disorders like eczema, and other disorders like migraine, chronic fatigue, and fatigue syndrome, etc. So when a person is having prolonged psychological issues, so he is prone to develop these kind of physiological disorders. As altogether we name it as psychosomatic disorders. Next slide. So, this diagram can explain how psychosomatic disorders develop over time. So, it starts with prolonged anxiety or stress. It could be anything like ongoing worries or emotional stress, or prolonged psychological pressures, etc. So, as we have already discussed in our previous slides, that the key idea of this topic is both mind can influence the body and the body can influence the mind. So, prolonged stress can not only affect the mind, but it can also affect the body too, which results in persistent psychophysiological reactions in long run. So as the mind and body constantly interacts with each other, it can create disturbance like increased heart rate, or muscle tensions, or migraines, or any other stomach problems, etc., which can altogether result in structural alterations, cellular diseases, and functional impairments in the body. So when the stress is continuous and for a long term, it can no longer be a temporary problem. It can change, it can convert or change into real physical problem, which can eventually develop into psychosomatic disorders. So few examples of psychosomatic disorders, or we have already discussed in our previous slide, like irritable bowel syndrome, migraines, and peptic ulcers, etc. So the key point here is prolonged stress or anxiety can eventually progress into psychosomatic disorders. So below are a few symptoms of psychosomatic disorders. So physical, emotional, and behavioral symptoms. So pain, fatigue, headaches, and digestive issues are few physical symptoms of psychosomatic disorders, and some few emotional symptoms are irritability, sadness, anxiety, etc. And few behavioral symptoms are sleep disturbances, withdrawal symptoms, and reduced productivity, etc. So these are few symptoms that we generally come across in the people who are suffering with psychosomatic disorders. So here comes a key idea of today's topic, that is body mind connection. So you can see that stress can activate hypothalamic pituitary adrenal axis, which is a system that links body and the endocrine gland to regulate the body's response to stress. So when there is a frequent stress within the body, or when the body is continuously facing stress, it can directly cause hormonal imbalances within the body. And as we have already discussed, prolonged stress can weaken our immune system, and which directly triggers physical illnesses in the body. So this slide explains the diagnosis process of psychosomatic disorders. So the first and foremost thing is we need to check out the medical condition of a person. We need to evaluate the medical symptoms and medical condition of the person, because there is all possibility that the physical illnesses will sometimes look like psychological problems. So once the medical evaluation is done, the emotional, cognitive, and behavior factors of the person will be evaluated using interviews and standard techniques. So this we call it as psychological evaluation. So once the psychological evaluation is done, next we go to the stress observation. So we observe the stress pattern and how the person reacts in stressful situations. So here comes the most important part of today's topic, that is treatment. So we have few medical treatments to overcome the symptoms of psychosomatic disorders like stress, anxiety, and depression. So medication helps a lot, and along with the medication, we also have psychological therapies like cognitive behavioral therapy, stress management, problem solving, time management, etc. And few relaxation techniques also helps a lot to overcome psychosomatic disorders. And along with all this, we also need to have some lifestyle changes, and social support is also very important and helpful for a person to overcome psychosomatic disorders. So limitations of psychosomatic disorders. So most the major limitation of psychosomatic disorder is diagnosis itself. So most psychosomatic disorders are left untreated and undiagnosed, because thinking that the person is just trying to seek attention, instead of believing that the person is really having the symptoms of psychosomatic disorder. So these psychosomatic disorders are increasing its prevalence in recent times because of academic pressures, competition, social media, economic stress, uncertainty, and technology overload are giving scope to psychosomatic disorders. And these disorders are seen in almost all age groups, and it's affecting multiple body organs. And because of its prevalence, it's also gaining importance on recognition in healthcare profession too. So, to conclude, psychosomatic disorders clearly demonstrate a strong connection between the mind and the body. So, it highlights how emotional factors, mental factors can really lead to psychological illnesses. So, early recognition plus holistic approach is a good way for a better health outcome. And therefore, treating the mind is as important as treating the body is the key point here. And social awareness programs and counseling and mental health care programs have become need of the hour to bring awareness and to educate the public about psychosomatic disorders. With this, I end my presentation here. Thank you all for your valuable time.